During the past decade, Rafiki Surgical Missions has treated more than 1,000 patients in Tanzania, repairing cleft lips and palates and other facial deformities, as well as helping burns victims regain movement in injured limbs.
Yeah, I mean, one thing you think sometimes and you hear people say is that your surgery is just a drop in the ocean because there's so many people in Tanzania with problems. And to a certain extent, there's a little bit of truth in that. But when you meet the people and you see that little one drop has had such a dramatic difference to their lives, and it's not just that one patient, it's their family, it's their friends, it's the entire village, you really feel that you really are making a really significant difference to all these people's lives.
While Rafiki is a relatively small, self-funded volunteer organisation, the ripple effect of 10 years of surgical missions has had a big impact on the communities it is working with in Tanzania. With 2 volunteer surgical teams and ward and support staff, each mission can see up to 100 patients, undertaking procedures that range from simple 30-minute fixes to complex operations over many hours. While on past missions, many of the surgical teams have recuperated from their 2 gruelling weeks by going on safari to experience Tanzania's amazing wildlife. To mark 10 years of Rafiki surgical missions, Rafiki veterans Andrew and Taka Wild embarked on a very different type of safari, to track down some of the people Rafiki had helped over the past decade. The majority of patients treated by Rafiki come from the remote rural areas in the north of the country. For many of them, getting to the hospital for their treatment can take days, using buses, bicycles and even on foot.
I knew the patients were coming often from pretty isolated places, and that was certainly the case. Sometimes you'd drive for 2 or 3 hours just to find a tiny village where the patients were. There'd be nothing for miles around. You'd sit in one little mud brick house, and that's where the patient and their family lived.
In 2010, Bahati rented a bicycle to make the 4-hour ride to the Rafiki pre-mission clinic in Kahama. Selected for surgery, he then had a 12-hour bus ride to Dar es Salaam, where he underwent an amazing transformation. 3 years on, Andrew and Taka were keen to see what progress he'd made since his operation. Operated on as an adult, Bahati had endured a childhood of taunting and marginalisation. The surgery gave him the chance of a new life, free from the stigma of deformity.
He was still a bit on the shy side, but obviously very appreciative of the surgery. His whole family and friends, they all gathered around very quickly, and were all obviously really, really happy that Bahati had had his surgery and had his life really changed very significantly for the better.
Importantly, it had also delivered peace of mind for his mother and a release from the guilt she felt for bringing her son into a world that judged him on his appearance, not his humanity. In fact, when very young children are treated, it is often the families of the patients who are most thankful for the results of the surgery.
This family, I think it had 8 children, and the middle 3, one after the other, had all been born with cleft lips. And the mother told us that she thought a witch must have visited their village, and that's why the 3 children in a row all had cleft lips. And it had really, really distressed them a lot. And so they had the lips fixed, 2 of them on one mission, and then the 3rd one on another mission, I think. And it just made a dramatic difference to the whole family. I think they felt that they could put that completely behind them and move on with their lives. So it was a great story, great story.
We have heard many stories of children with clefts who were previously poor students, returning to school after their surgery with a new desire to learn, quickly integrating with their peers and going on to excel at their studies.
I think it's very easy when you're doing the surgeries just to see the people as patients, and you've got a job to do. You do the job, then move on. But when you go and visit them 2 or 3 years later, you can just see what a fantastic change it's made to their lives.
Sadly, over the years, the teams have seen many cases in Tanzania where early treatment would have prevented a lifetime of health and social issues. And being able to provide real help to people with very real health issues is the essence of the Rafiki surgical missions.
Simon had a terrible problem, which had started when he was about 3 years old, so he'd had it pretty much his whole life. And it had resulted in really the side of his jaw and mouth being eaten away. And as his mouth developed, his teeth jutted out. He didn't really have a proper mouth at all. His mouth was all to the side, so when he ate, the food went absolutely everywhere. Very, very disfiguring. And even his brothers said that until he'd had the surgery, nobody could really put up with eating with him. Only his parents would eat with him. And some of the people in the village were really quite scared of him.
While not an everyday Rafiki procedure, over many hours in the theatre, the surgical team was able to rebuild Simon's face. And he can now join in with his family's meal times and festivals. No more hiding in the background.
I mean, I always knew that it was really worthwhile surgery, certainly for the patient. But it's given me a broader perspective, really. I can see now that, first of all, that the patient is living under difficult conditions, and anything you can do for them to improve their life, and that the surgery really improves their life, is a fantastic thing. But it also has the flow-on effect to their whole family, their whole village, and everybody who's known them and sees what's happened. So the effect of the surgery is much greater than I'd ever thought, really. So it really does encourage me and reminds me that it's such a worthwhile thing to be doing.
As Taka and Andrew's safari came to a close, it became clear to them that in these close-knit communities, where family strength is a key to survival, the work of the Rafiki surgical missions is opening doors to a better future. Every procedure that is undertaken makes a difference, and every life that is changed makes the community stronger. Asante Rafiki.